Every day, this dispensary in the Rufiji District of Tanzania sees children who are ill. Finding the right treatment is not usually an easy task, yet at this clinic, a primary healthcare worker is doing just that. It's a job that, in the developed world, is reserved for doctors or nurse practitioners. The health worker is using a diagnostic toolkit developed by the World Health Organization and UNICEF called IMCI, Integrated Management of Childhood Illness. With the help of tools developed by the Tanzania Essential Health Interventions Project, TEHIP, district health management teams chose to implement IMCI in their areas.
It looks at all possible health problems that child has. It spends time with the child, spends time with the mother, discusses the problem with the mother, comes to a diagnosis without a laboratory support.
The health worker asks questions of the mother or caregiver. By following the IMCI guidebook, in most cases the health worker can reach an accurate classification quite quickly. IMCI rose to the first priority in local health plans once the system saw evidence that this single strategy would address almost 40% of the total health problems of the population.
Yeah, we ask and assessing even if the mother didn't mention. We ask and then if say yes, he has a problem, such problem, we assess.
Part of the process is to ensure the mother or caregiver knows how to administer any prescription or treatment. She demonstrates this directly to the technician before she leaves the dispensary.
It means that very low-level peripheral health workers can use it with confidence. Comes to a diagnosis and treatment is provided on the spot, and that treatment is observed. The first dose of any treatment that's required is given, and the instructions are fed back to the health worker, so the health worker can be sure that the mother understands the instructions, and the danger signs for what to look for next or what to look for in the future for any childhood illness are well explained, and what to do at home. We've been managing childhood illnesses for a century at health facilities, but this is a fundamentally new approach which takes a holistic look at the child.
That is one of the key aspects of the IMCI approach that is paying off in Tanzania. In effect, the healthcare workers are really treating the child rather than the disease. This is especially important as often there's more than one disease contributing to the child's condition.
The 5 leading diseases or childhood illnesses that cause death in the under 5 age group. So it is designed in a way that when you train people, you provide them, you provide health workers with skills in integrated management of childhood illnesses. The first thing is that you enable them to manage in a comprehensive and a complete way the sick child.
And Dr. Mgalala says TEHIP has the evidence to demonstrate the strategy works.
During the last year health facility survey that was done, where it was found that under 5 child health indicators were better in IMCI areas than where there is no IMCI.
So what the project has demonstrated is that for relatively low cost you can improve the quality of health services and the health status for children in rural areas. And you can do it by using primary healthcare workers trained to use the IMCI strategy.